this is a little lunch and learn on tobacco, vaping, and also the Tobacco and Vape bill. And then it's made by the Addiction Team, Public Health, for myself and Georgia. So the aims of the session is all about building, understanding a bit about smoking and inequality, but also within Birmingham. Smoking as an addiction rather than a lifestyle choice. And also vaping as a stop smoking aid, youth vaping, and obviously as well as the bill itself. So yeah, to begin with, tobacco and smoking. So a bit of background around the harms from tobacco. So tobacco contains nicotine. So it's a highly addictive substance, and amongst British smokers, around 2/3 would like to quit, but some find it challenging due to dependence. About half of all lifelong smokers die early, losing on average about 10 years of life. And also secondhand smoke, otherwise known as passive smoking, is the breathing in of other people's cigarette smoke, and long term of exposure of secondhand smoke increases the risk of a range of smoking related diseases, including cancers, lung cancer, COPD, emphysema, stuff like that. Within Birmingham, so the Birmingham smoking prevalence in 2023, the smoking prevalence was 14.5% amongst adults, compared to 12% for the West Midlands and 11.6% for England. And then on the right there's just like a little map, a little heat map of Birmingham itself, showing the inequalities and the differences between the prevalence, the darker shade being the higher prevalence of smoking, and the lighter being the lower, and that's for 22-23. And then just contrasted it against, I guess, the government pledge. This was made quite a while back now, to make England smoke free, which by 2030, which means a prevalence of 5% or lower. Obviously, we're quite a way, way from that, and there's not long to go. Next slide.
Simon, before you carry on, we've got a hand up from, is it Nick, I think?
So cheers, Nick. So I can't see any hands being raised. Go on,
no,
Nick,
apologies. That was an accidental hand. I don't know. Oh. Sorry about that.
Oh, don't worry. Right. Thanks, Georgia. And then just picked out some groups here, just again showcasing prevalence, differences in inequalities. So for Birmingham, the smoking status at time of delivery, 6%, England 7.4%. Routine and manual occupations, 25.5%. Obviously a lot higher than that 14.5%. Also long-term health conditions, a lot higher, 28.2%. And then probably most shockingly, smoking prevalence of those at the start of substance misuse treatment, 86%. So a lot higher than the general population, the general public. So this slide here, I'll put in, because sometimes, you can read off stats, but it doesn't give you like the full picture or the full understanding. I thought this video was like a really good way to just showcase the benefits that this individual had from quitting smoking. It's also a place I know well, so this was filmed in my hometown. And I know that the tobacco dependence advisor who helped this person to quit smoking. Just a little 2-minute video. Hopefully everyone can hear the sound.
My name's Marissa White and I'm from the Croydon area. Well, I was brought up in a bit of a rough area with drugs and things like that. So I learned from an early age how to do things. I never turned to drugs, but by the age of 9 I was trying to smoke. By the age of 11 I was smoking 10 to 20 a day. And then I carried on smoking for 15 years until Tracy helped me when I was on a ward. And in April it was 3 years since I quit smoking. But when I was smoking, I got brittle asthma, so my chest would be really bad. I'd get pneumonia, constantly throughout the year, cough up blood, and my health was deteriorating. But as soon as I quit smoking, my health picked up. I really get pneumonia, I really get chest infections. Whereas before I was getting pneumonia 3 or 4 times a year, I was getting chest infections once or twice a month. But now I'm free of smoking, I'm breathing a lot better, I'm more active, and I feel a lot better in myself. And I'm able to do a lot more things. I'm able to go out, I'm able to afford to buy nice things, do things, save up. It's just the world's better and bigger place when you're not smoking.
Yeah, I really like that video because I think it also showcases a bit about what we were saying at the start of the aims around, is that a lifestyle choice? Is it an addictive disease? Started smoking at 9 years old, is that a lifestyle choice? But yeah, really, really impactful video. I love that video. And around the corner from where I grew up is Bethlem Hospital in South London. Right, let's see if I can get to where's my mouse gone? There we go. And so local stop smoking support in Birmingham. So there's a little map showcasing where we can access stop smoking services. So pharmacies, GP practices, people looking to quit smoking can get access to free 12-week behavioural support, NRT, nicotine replacement therapy, and vapes. There's also an app for your phone, so Quit with Bella. But you can also get access to, NRT and vapes as well as there's a NHS tobacco dependent services as well. So within, mental health acute, inpatient, as well as community settings as well for stop smoking, which has been a brilliant addition. I think it's going to really help drive those smoking prevalence numbers down in the next few years. And then a little bit about illicit tobacco. I've sort of framed this with that first bullet point, just as it's a really important point to make that all forms of tobacco are harmful, whether it was bought from a legal or illegal source. HMRC estimates that the illicit market in tobacco duty and related VAT was 2.8 billion in 2021 to 2022. So the illicit market in tobacco is huge, as a percentage of the total tobacco market in the UK, it is massive. And why is this, a focus for public health and tobacco control work? So, introducing, big tax rises for tobacco products has been really, has been a great policy lever to encourage smokers to quit, as well as discouraging younger people to start smoking. Illegal and illicit tobacco being at cheaper prices can really undermine those types of policies. So it is really important for that enforcement work to take place as well. And that's I'm going to hand over to Georgia now, just to talk about vaping. Thank you, Georgia.
Cool. Hi everyone. So I'm going to talk about vaping. You'll have to excuse me. I've got a bit of a cold / cough, so I don't sound my best. But yeah, I thought I'd give a little bit of an overview. I'm sure most people know, but I thought I'd define vaping. So it's the use of an electronic nicotine or non-nicotine delivery system. So that essentially means that it may or may not contain nicotine. The Royal Society of Physicians estimates that vaping is approximately 95% less harmful than tobacco smoking. So we'll kind of touch on that more, but it's often used, as I'm sure you know, as a stop smoking aid, and can be quite effective. So it was quite hard to find vaping prevalence data for Birmingham in particular, but I did find an evidence summary from the Office for Health Improvement and Disparities that found that in England in 2022, so adult vaping prevalence was 8.3%, youth vaping prevalence was 8.6%, and that's compared with 4% in 2021 and 4.8% in 2022. So that 8.6%, sorry, in 2020. So that 8.6% in 2022 is quite a sharp, a significant increase, and we'll talk a little bit more about youth vaping in the following slides, and why that might be. And then also just identified some groups that are more likely to vape. So men, adult men and current smokers are more likely to vape as well. So they might be a group that we want to focus on. So vapes are relatively new. and the long-term health effects haven't really been observed yet. But there's some evidence of risks to health. So kind of a major one is a nicotine addiction. If people are using vapes that contain nicotine, they may become addicted, especially if, particularly with young people who start will start vaping if they're non-smokers. That can kind of cause a nicotine addiction. Anyway, but yeah. The effects of vaping on fetal development and pregnancy outcomes remain in particular need of research. So the evidence summary kind of mentioned that, and yeah, it's kind of too early to tell, but there could be some kind of association between pregnancy and vaping, and it may exacerbate respiratory conditions as well, especially if people are vaping who've smoked before and might have COPD from smoking. It can exacerbate it, even though it's still an effective kind of stop smoking method. And just to say, there's some very, very early research, and there needs to be more research about other conditions that vaping could cause. So the kind of substances in vapes, things like cancer and heart disease, but I haven't put it on the slide because it's very kind of early evidence, and there needs to be a lot more research, but it's just something to kind of keep in mind and look out for in terms of research if that's an area you work in. Next slide, please, Simon. So yeah, spoke a bit about vaping as a stop smoking aid. So nicotine vapes have been found to be an effective stop smoking aid. They don't burn tobacco, and they don't produce tar and carbon monoxide, which obviously tobacco cigarettes do, which pose significant health harms. So I found 2 reviews that kind of have quite similar results. So one from 2021 found that people who used vapes to quit smoking, as well as having behavioural face-to-face support, so that's kind of important to remember, is that it's not just one thing that might help someone quit smoking. It could be like a whole system of care and methods. But they can be up to twice as likely to succeed as people who used other nicotine replacement products, such as patches or gum. And then kind of similar results, a Cochrane review from 2022 found that people were more likely to stop smoking for at least 6 months using nicotine vapes than using nicotine replacement therapies. And there was also some evidence that nicotine vapes led to higher quit rates than vapes without nicotine, or no intervention at all. But there was less data that contributed to those analyses, so that's important to remember. Next slide, please, Simon. Thank you. So this is just kind of a visual graph. I'll speak about these rates in the next slide as well, but I just thought I'd put it in so you could see the kind of rates of vaping over the last 10, 11 years. So as you can see, in 2013, young people aged 11 to 17 who currently vape, the rate was 0.8%, and it's now 7.2% in 2024. So that's quite a kind of significant increase over the last 10-ish years. And particularly with those who currently vape and those with those who ever vaped, there's quite a similar pattern in 2021, where there's been a bit of a decline and then quite a sharp increase, particularly for those who've ever vaped, up to 2023, and then it sort of started to come down again in 2024. So yeah, there's some sort of patterns in the data, trends in the data for young people, but it's kind of generally that more young people are vaping in recent years than they have been over the last decade. Next slide, please. So yeah, like I said, there's some prevalence data there. So 18% in 2024, 18% of youth aged 11 to 17 had tried vaping, which is 980,000 children in the UK. And in 2024 again, 72% of 11 to 17-year-olds who are aware of vapes report that they were exposed to some form of vape promotion. So the main sources being in shops and online. And talking a little bit about the harms or the risks of vaping. So young people can be more susceptible. Some evidence has found that vape use can increase conventional cigarette uptake, particularly among non-smoking youth, by nearly 3 times. And that's kind of related to this next point, is that nicotine is more risky for young people than for adults. Evidence suggests that the developing brain is more sensitive to its addictive effects. So if they're more sensitive to kind of the effects of nicotine, they might also be more likely to use conventional cigarettes. This will be addressed in the Tobacco and Vape bill bit that will come next, but some disposable vapes are marketed towards children and young people. So some have cartoon characters. A lot of the flavours are quite kind of childish. Well, not childish, but they're very sweet and kind of relate to like candy or sweets. Oh, sorry. And some disposable vapes on sale are illegal and don't meet UK safety regulations, so they can contain high levels of harmful substances. And also some vapes that are marketed as no nicotine actually have been found to contain nicotine. So yeah, that's kind of a sort of summary of how vaping can be a risk to young people. And then I'll hand over to Simon to talk about the Tobacco and Vape Bill and how it can kind of address some of these concerns that we've highlighted. So over to you, Simon. Thank you.
Yeah, thanks, Georgia. And we're absolutely rattling through this, guys. So you'll definitely get some time back. But yeah, just to touch on the bill, the Tobacco and Vape Bill. So it was introduced under the previous government to prevent addiction to tobacco and vaping before it starts, stopping the start. And then key ambitions included create the first ever smoke-free generation, reduce the appeal and availability of vaping products, and strengthen the enforcement of underage sales of tobacco and vapes. And there's also going to be a post-implementation review for the bill 5 years down the line after it's come into force. So why is it important to introduce these measures? We've sort of touched on the harms from tobacco before, but I guess just to echo that, smoking is the #1 preventable cause of death, disability and ill health in the UK. Prevention is better and cheaper than cure. And these measures will shift the health system from treatment to prevention. And under the new government, they've sort of included this line here about tackling the social determinants of health as well. So I think it's looking like there's been quite a few positive amendments to the bill under this new government, which is great. And then again, just from the CMO a few years back now, but Chris Whitty, I think this encompasses everything really well, and it's just a nice little message to have, because there's a lot of misinformation out there. So if you smoke, vaping is much safer. If you don't smoke, don't vape. Marketing vapes to children is utterly unacceptable. So creating the first ever smoke-free generation. So the bill will make provision about the supply of tobacco, vapes and other products, and this includes prohibiting the sale of tobacco to people born on or after the 1st of January 2009. So what does this mean? This means that children turning 15 this year or younger can never legally be sold tobacco. The key word, they're being sold. So it's not, we're not going to criminalise people for purchasing, especially if they've got dependence to nicotine. Subject to approval for Parliament, the age of sale restrictions for tobacco will come into force on the 1st of Jan 2027. So it's not too long away as well. And then I guess a little update just from last week. So Parliament had the bill's second reading and on the 26th of November, and the vote passed with a majority of 415 in favour and 47 against. So a real landslide there as well. So it's looking to be very positive, but we hold our breath. So reducing the appeal and availability of vaping products. So continuing on from what Georgia said previously, the bill bans the advertising and sponsorship of vapes and nicotine products and allows ministers to regulate the flavours, packaging and display of vapes so they do not appeal to children. All vaping and nicotine products will be banned from being sold to under 18s. The free distribution of vaping and nicotine products will be banned. The next one may be a bit of a controversial one. This is a separate legislation on environmental sort of DEFRA. So there'd be a disposable vape ban from the 1st of June 2025. There's a lot of background work in terms of what impact this will have, and it's particularly amongst our more vulnerable populations, thinking of rough sleepers, particularly substance misuse treatment service users, about not having access to being able to charge vapes, etc. What impact is that going to have for people looking to quit smoking, or who have already quit and who are trying to remain away from tobacco smoking? Vape liquid tax due to be introduced October 2026 as well, and there's a technical consultation which I believe is still open from the government, just in and around that liquid tax, but some other factors as well around these updates about vaping products. So strengthening the enforcement of underage sales of tobacco and vapes. So the bill provides powers to introduce a new retail licensing scheme in for tobacco, vapes and nicotine products, which is really positive. Gives us a bit more power sort of locally. and the introduction of a new £200 penalty notice in England and Wales. So really, given trading standards that on the spot powers to really clamp down on offences, so including underage sales, illicit tobacco, and illicit vapes as well, which is a huge problem in Birmingham, which I'm sure most of you already know. And then again, I touched on the amendments to the bill that this government has made. Here's just encompassing what those are. So the additions are powers to create a retail licence regime, powers to extend smoke-free legislation to public outdoor areas, powers to prohibit vaping in smoke-free places, a ban on vape advertising and sponsorship, further powers to regulate the design of vapes, increasing fixed penalty notices to £200. And I've just popped in there because it's been in the news a lot as well. It's been a bit everywhere really. So a frequently asked question regarding smoke-free outdoor areas: will smoking be banned outside pubs and bars? So in England, hospitality settings, this includes outside areas of pubs and bars, will not be included in the proposed extension to the indoor smoking ban. This is still under consultation, these additions, and what the current government are looking at doing is implementing smoke-free areas in playgrounds as well as hospital settings, hospital grounds. That's what they're initially looking at as well, just to let people know, because a bit of misinformation around that one as well. That concludes the presentation. This slide can be shared around with everyone. It's got some references in as well, but there's also Georgia and my email address there. But yeah, I'll stop sharing, and if anyone's got any questions, feel free. Feel free to put your hand up or put it in the chat. I think I see there's one in the chat there. Oh, Evie, do you wanna jump in?
Hello. Yeah, I put one in the chat around the kind of mirroring of the Australia vape ban that's going on at the moment. Theirs is pretty extreme, but I think is probably in a radical way quite good. But they're limiting flavours to I think it's mint, menthol, and tobacco, which are pretty horrible flavours, really. And Georgie, you mentioned earlier about how kind of the flavours are kind of targeted towards maybe younger generations or people who haven't smoked before, because not many people opt for a tobacco flavoured vape. And you mentioned they're limiting flavours. Have they been specific around what they're limiting to, and whether they're going to mirror that in Australia?
Yeah, thanks, Evie. So they haven't come out and said exactly what they're going to be, but when they talk about limiting flavors, this can be the characteristics of the flavor. So it could be the smell, the flavor, but it could also be the naming, or the design of it as well. They were looking into, whether to just have tobacco, mint, and menthol like they've chose to do in Australia, but also to include fruit flavors as well. The challenging thing is that if you do one thing, there's always unintended consequences. So most smokers looking to quit smoking using a vape choose fruit flavors. Would that have a negative impact on smokers looking to quit? So I don't know. I never think it's like a straightforward, way to go down. But just to be more specific, either they haven't. It's not been sort of publicised yet, either.
Okay, fab. Thank you.
No worries, thank you. Gerber, thank you for your conversation. I've just seen as well. Sorry about the echo before. Yeah, I think my laptop is struggles when I share my screen. So is it easy to spot fake vape? Yeah. So I think I'm probably going to get this wrong now, but if the vape says over, you can get over 600 puffs, from a single use or disposable vape, then it's not going to meet the regulations, as well as if it's got more than 2 milliliters in the tank size is more than 2 milliliters, then it's an illicit vape. But just to give you a bit of context there, trading standards are always visiting premises based off intelligence, and more often than not, they're finding illicit vapes being sold, huge quantities around Birmingham. So it is a huge issue. So thank you for asking, Gervir. feel like that's everything. I'll stop recording. I have given you